Good day, sir. I'm Chong matrix number 201880. We are from Group 8 and would like to share the impact of ICT on health communication. So, basically, ICT, also known as the Information and Communication Technology, is used to handle the communication processes, including telecommunications and audio-visual processing, as well as the transmission system. It is crucial in healthcare industry and many ICT tools are adopted in this sector. For example, ultrasound imaging device, infection detecting technologies, and also the portable patient monitors. ICT is essential in the current social order, especially in light of COVID-19 global pandemic that happened over the past 2 years. The use of ICT in healthcare sector during the outbreak has brought a lot of advantages such as promoting low cost, patient-oriented healthcare services, improving service quality and information interchange, as well as educating both professionals and patients. For instance, a free virtual health advisory through the MySejahtera and also the Doc2Us applications are offered to the public in terms of delivering care to combat the virus.
Hi sir, I'm Choo and my matrix number is 269772. Health communication can be used to inform individuals about healthcare knowledge and best practice to improve patient health outcomes. There are 4 types of health communication. The first is health promotion, which is conduct health campaigns aimed at reaching specific audiences and communicating important health information. The second is patient-provider family caregiver communication, which is the communication between the patient and their healthcare team and their families. The remaining 2 types of health communication are healthcare intervention and health communication technologies. In terms of functional role health communication, the first is information. Health communication can provide people with scientific knowledge or information about health issues, as well as how to maintain health. The second is motivation, which inspires individuals to apply health information to their personal behavior and lifestyle. The third is health education. It increases knowledge and awareness of health issues, problems, solutions, which influence perception, beliefs, attitudes, and social norms.
Good day everyone, my name is YEOW, matrix numbers 271746. Now I will share about the impact of ICT on health communication. The impact of ICT on health communication is to improve the quality of healthcare. The rising usage of ICT resources in hospital has aided in the improvement of patient knowledge level. The reason is that patients may understand the visual perspective of their health status by using computers, the digital ICT equipment. So ICT can help patients obtain better care by reducing medical errors, enhancing communication and increasing for efficiencies. Okay, next, the use of ICT tools can help the patient have an opportunity to understand their health state from a visual standpoint. The use of integrated ICT system for patient diagnosis and not only the prevention of medical errors has gone a long way, but also the quality of healthcare outcomes as well as the patient safety. So at last, the ICT also changed the structure and organization of the health information system to become better and more convenient to be used. The other aspect of healthcare quality including affordability, contemporary medical technology, and effective treatment, whereby using the ICT as the tools to help easily retrieve the information. ICT can be used to provide data to patient or clinician for consultation. Thus, medical records will be accessible to the patient at any time and anywhere. In conclusion, the health communication in ICT improve patient and safety by minimizing medication errors, adverse drug reaction, and adherence to practice recommendations. Hence, the ICT in health communication can help to improve the quality of healthcare and the information sharing between the patient, nurses, and doctors. That's all from me. Thank you.
The second is facilitate more efficient communication among medical staffs. With the support of ICT, it can help to reduce some communication failures between physicians and nurses. In health communication technology, the doctor can make a more detailed communication in explaining the relevant medical aspects with the nurses through the computer data display. As the development of ICT, the medical team members can transmit information and conduct discussion among them, even at remote distance. In this way, it enhances the connectivity of the holistic healthcare team. Hence, it can be seen from this that the influence of ICT in effective health communication between medical staffs is quite large. As for the third impact ICT on health communication, I will pass to my next teammate to continue. Thank you.
Besides, ICT on health communication also helps in cost containment. Through the invention of ICT, both doctors and patients are able to interact virtually for health-related services such as observation and consultation through services like Doctor On Call, Speed Dial, and also Home GP. ICT plays an important role in providing cutting-edge healthcare more affordable while eliminating the need for lengthy physical consultation wait times. Virtual care does contribute to healthcare cost reduction in two ways. First, it improves healthcare for everyone at an affordable cost and makes clinical treatment more accessible to individuals. Second, enable doctors to provide primary care and eliminating the need for pricey emergency room visits because doctors can diagnose and also access to more patients remotely in less time with the advanced telemedicine system. So in the long run, the appropriate technology can assist reduce overall medical expenditures while simultaneously enhancing patients' health. So that's all from me. Thank you.
My name is CHEN, metric number 269525. The ICT on health communications also benefits in the discovery of possible disease prevention strategy to eliminate and minimize the illness transmissions. As we know, we can know all the cases around the world through the ICT, especially the rare disease. In this way, the doctor can find the similar cases and communicate with that doctor immediately so that the patient can receive the treatment as quickly as possible. Besides, with the new technology in diagnosis which reduce the time and cost, we can know the progress of medical technology around the world through ICT in order to find the best treatment plan, shorten the treatment time and reduce the cost. Besides, in case of emergency, the doctor can use the video call to understand the general condition of patients and to make the consultation through the video calls to avoid missing the best treatment time. The traditional healthcare system can be replaced using the ICT and the new models for effective quality treatment may be developed. Healthcare institutions are incorporating digital health devices into their remote patient monitoring and direct-to-consumer initiative to increase the engagement and outcomes. That's all from my part. Thank you.
Good day, my name is PAUH with matrix number 271997. Last but not least, the impact of the ICT on health communication to boost the development of home healthcare service across the world. So the advancement of the ICT technologies lead to the development of unique electronic healthcare service that not only enhance the human health and well-being but also contribute to the long-term viability of our community. So the ICT have the ability to promote the patient-centered healthcare at a reduced cost, increase the quality of treatment and information exchange, educate the health professionals and patients, foster a new type of interaction between the patient and their health providers, and so on. So besides, the home healthcare service monitor the service user health and well-being, allowing for targeted support where and when is required. The home healthcare service will collect the patient's personal data in particular, which is subsequently analyzed by the medical specialist in order to give the therapy. In this situation, patient can get advice or be monitored anytime instead of going to the hospital or clinic for the physical checking. Since the technology rise, the service is able to provide the user with some personalized self-management tools and resources which are helpful to them, such as the remote patient monitoring, the RPM. So the RPM system are linked to the patient and their care professional through the customer device and internet, allowing for new care model. They let the patient remain at home while being connected to the monitoring equipment or sensor that are becoming smaller and more flexible. In conclusion, the convenience brought by the technology almost fulfill the community daily life. So for instance, a handphone has become an essential tool for humans to communicate with people, to complete his or her works, and to entertain himself or herself, and so on. Therefore, the development in ICT should benefit the health communication due to the human health is the most important to ensure that the community stay in a safe and comfortable space. Based on our research, we can know that The development in ICT did bring the advantages to the health communication, such as the quality of healthcare improved, the facilitating more efficient on the communication among the medical staff rather than before, decreasing the cost of the healthcare, helpful in finding the possible preventive measure to eradicate and reduce the spread of the disease, as well as boost the development of home healthcare service. Clearly, ICT playing an important role in the modernization of healthcare service, and it has the potential to improve the quality and reliability of healthcare data and service. Thank you.